According to the CDC, babies who are breastfed are less likely to develop some health problems. It also is a way for mothers to bond with their babies. But breastfeeding is not always possible. As part of our Ask the Expert series in partnership with Bon Secours St. Francis, 7 News' Jennifer Martin talked with a lactation consultant about how even adoptive mothers can breastfeed.
I love you.
Jessica Donahue and her husband adopted their child Sailor 4 years ago. As a former nurse who struggled with infertility, breastfeeding was important to her.
I just always had just this incredible sense of joy when I would help a mama latch her baby on for the first time.
She knew it was possible to trick her body into producing milk and began a lengthy process of adoptive breastfeeding.
The protocol that we used is the Newman-Goldfarb method.
Lactation consultant Mandy Schaub guided her through the process, which for Donahue involved using prescribed hormones to mimic a pregnancy, taking natural supplements, and using a hospital-grade breast pump for stimulation.
We try to mimic what would be happening if the baby was actually directly nursing in terms of trying to help her make milk.
Schaub says some of these techniques can be used for any mother having breastfeeding issues.
Stimulation with a pump can cause a rise in hormones that are used for milk making.
Schaub says ideally pumping begins months before the baby arrives.
The more time you have, the more milk volume a lot of times you end up with.
And that the mothering hormone oxytocin can be released naturally.
That's one of the things that can be released just by holding a baby.
Donahue cautions adoptive mothers to weigh the pros and cons before going through the process and have realistic expectations for production.
It's a lot of dedication. Every 2 to 3 hours, I breastfed my son and I supplemented him with donor milk at the same time.
In general, the American Academy of Pediatrics recommends that mothers exclusively breastfeed their infants for 6 months and continue breastfeeding until the baby is 1 year old. The World Health Organization, however, recommends continuing until the baby is 2. For 7 News, I'm Jennifer Martin.
And for more information on adoptive breastfeeding or to submit a question for our series, visit our website, click the News tab, then click Ask the Expert to hear more from experts at Bon Secours on this topic and others. Listen every Saturday morning at 10 a.m. on 106.3 WORD Radio.